All right, chapter 5 is going to be medical terminology. Um, uses fundamental anatomical medical terms and abbreviations in written and oral communication with colleagues and other healthcare professionals. So, medical terminology is used to describe and record every aspect of patient care. Incorrect medical terminology usage could lead to ineffective and even harmful treatment and cause the patient to lose trust in your ability. Um, so basically, when you start using medical terms, you need to be able to understand what you're saying. Um, these were all have Greek and Latin origins. Um, they are the name of diseases, devices, procedures, or drug based on the person who invented, discovered, or first prescribed it. Um, some of the examples are the Foley catheter, um, McBurney point, as far as anatomical um, relations, the Babkin reflex, Crohn's disease, the cesarean section, the Levi sign, the Apgar score. All these were named after the people that invented it, like most things are. Homonyms are a pair of words pronounced the same but spelled differently with different meanings. Example, ileum can be spelled ILEUM or ILIUM, spelled differently, but pretty much mean the same thing. Autonomies are a pair of word roots, prefixes, or suffixes that have opposite meanings. Example are EU, like it's good, or mal, MAU, correction, MAL, which is bad. So synonyms are a pair of word roots, prefixes, or suffixes that have the same or almost the same meaning. So pneumonologists and pulmonologists, both mean the lung. So, components of medical terminology are the prefix appears at the beginning of the word, generally described the location or intensity of the word root, also used in specified time, quantity, and or number. The suffix appears after the word root, changes or adds to the word's meaning or provides further definition, usually specifies a procedure, condition, disease, or part of speech. Okay. Word roots establish the basic meaning of a word, frequently indicate a body part, and several word roots are used to describe color. So colors like cyanos, um, CYAN is blue, Luke is white, urethro is red, um, um, melon is black, polio is gray. So there's different kind of um, word roots that are used to describe color. Combining vowels facilitate the formation of new complex terms. So a combining form is the word root, prefix, and suffix with a combining vowel. One example is osteopathic, from osteon is Greek for bone. The N is dropped. The combined vowel O is added to create the combining osteo. So adding the O facilitates the addition of a second combining form, pathy, from the word patho, which means disease. So using a combining vowel before a suffix that begins with a consonant, using a combining vowel to join other word roots, correction, and do not use a combining vowel before a suffix begins with a vowel. So terms containing more than one word root. Each word root retains its same basic meaning. Electrocardiogram and thermometer. Plural endings. To change a medical term from singular to plural, which means more than one. Words ending in A change to AE. Vertebrae and vertebrae. Words ending in IS change to ES. Diagnosis before it becomes diagnoses. Words ending in EX or IX change to ICES. Example, apex become apis. Words ending in ON or UM change to an A. Ganglion becomes ganglia. So, and then your words ending in US change to I. As bronchus becomes the bronchi. So, some topographical anatomy we'll go over. Frontal is the front. Sagittal is the lateral plane. You got ventral and dorsal. You got lateral, medial, longitudinal axis, cranial, and the transverse plexus also transverse plane also. The coronal plane divides the body vertically from ear to ear into the front ventral and back dorsal portions. The transverse plane, axial plane, divides the body horizontally at the waist. Sagittal plane divides the body vertically front to back. The axis is an imaginary line that divides the body equally and creates a point of rotation. Horizontal axis is perpendicular to the sagittal plane. Cross section is taken by slicing across an object perpendicular to its long axis. Specific body areas of the body. Many body areas have specific names. Body cavities, dorsal and ventral. You got the cranial cavity, vertebral canal, mediastinum, pleural cavity, pericardial cavity, which is the thoracic cavity itself, the abdominal cavity, the pelvic cavity, all that stuff. Just to name specific areas of the body. So you may use these terms to describe something housing something else. So directional terms describe relative body positions of the body parts as well as imaginary anatomical divisions. So they occur in pairs. So you have the superior and inferior, which is the superior portion is the portion above and the closest to the head from a specific reference point. Okay. You have the inferior portion, which is the body closest to the feet. The lateral and medial parts of the body that lie further from the midline or lateral, and parts of the body that lie closer to the midline or medial. Right, proximal and distal. Proximal describes structures that are closer to the body. Distal indicates structures that are farther from the trunk. Superficial or deep. Superficial is closer or onto the skin of the surface. Deep is farther inside the body away from the skin. Anterior, posterior. Anterior refers to the belly side of the body. Also called ventral. Posterior refers to the spinal side of the body, including the back of the hands. Okay? Also called dorsal. Palmar and plantar. The front region of the hand is referred to the palmar. The bottom of the foot is referred to as plantar. And the apex is the tip of the structure. Um, so basically, you may use these directional terms here, inferior and proximal, distal, and different things like that to describe different things that are going on with your patient. Um, a lot of times you describe where the hurt or describe where the pain is using these terms if you can't do a specific area. So right and left. Right is the patient's right. Always remember that. Left is the patient's left. Sometimes we all get this confused. Um, a lot of times I have to turn the way the patient's turning to describe their right and left. So top and bottom, superior, inferior, closest to the head, closest to the feet, middle and sides, medial and lateral, closest and farthest proximal and distal, in and out, superficial and deep, front and backs, anterior, posterior. Movement positional terms, um, flexion and extension. Extension is out, and flexion, of course, is like you're flexing, the muscle group itself. Um, Abduction and adduction. Um, Abduction is an extremity moves away from the midline. Adduction is the moves the extremity towards the midline. Hyperflexion and hyperextension. Hyper indicates the mechanism of injury, excessive movement of the body itself. So you may have hyperflexion of a body part beyond its normal range. So the hyperextension refers to the extension of a body part beyond its normal range of motion. Supination is turning the palms upward. Um, Pronation is turning the palms downward. Internal rotation is turning the extremity towards the midline. External rotation is turning the extremity away from the midline. Okay, and we just went over those. Some other terms are bilateral, appears on both sides of the midline. Unilateral appears only on one side of the body. Ipsilateral, same side of the body. Contralateral is the opposite side of the body. So the abdominary we usually describe in quadrants. Yes, we usually have an idea of what organs are in which quadrant, and we try to keep that in mind at all times. However, based on signs and symptoms, we can't always advise somebody, hey, look, you've got appendicitis, or you're having a gallbladder attack. We can highly recommend, or we may have a suspicion, but we cannot truly diagnose a patient. So we use the right upper quadrants, left upper quadrants, the right lower quadrant, left lower quadrants to describe their pain and area of discomfort. Position of the patient, of course, um, describes the body or describes movement of the body or something within it, indicates the location of an organ, foreign body, or mass. Um, A is prone. Um, so A is prone laying. Okay, B is supine, laying face up. Okay, I'm gonna correct this, y'all. This is um the notes don't match the PowerPoint here. So A is Fowler, sitting straight up with either the knees either bent or straight. B is supine, laying on their back. C is prone, laying face down. And D is semi-flower, sitting with the back at a 45-degree angle. Okay. So make sure if you're going to describe those, you become familiar. A lot of times I use those positions when I do my initial contact with the patient, and I can kind of describe how they were sitting. A lot of times we do have to put how they were laying on the ambulance stretcher also to use those. So abbreviations, acronyms, and symbols enable faster communication. Um, use only commonly understood acronyms and other abbreviations. So um, all acronyms and abbreviations may not all be, but not all abbreviations are acronyms. So abbreviations is pronounced with each letter separately. EMT acronym is forms of a word like USAR. So we say EMT is an emergency medical technician. USAR is the Urban Search and Rescue Team. So only use symbols that are widely understood and accepted, and avoid using trailing zeros after a decimal point, but including leading zeros prior to the decimal point. So avoid using zeros after the decimal point. Do not use 5.0 milligrams. It could be just, um, it could be read as 50 milligrams, is what this is talking about. So, if you're reading a report and you use 5 dot or period 0 milligrams, that could be misinterpreted as 50 if somebody was reading over it right quick. So, just use the 5. Don't do use 0.5 milligrams, not 0.5 milligrams. So basically use the 0.5 milligrams. However, because this, if you don't use the 0.5, it could be read as 5 milligrams. Symbols. Only use symbols that are widely understood and accepted. The Joint Commission requires every hospital to issue a list of approved abbreviations. So these are some of the common ones. However, State Office of EMS has an approved set of abbreviations and symbols and acronyms too. So that's what we need to follow in our terminology and stuff like that. So if you don't know what these mean, please don't use them. So be familiar with terminology related medications and medication administration. There are all are of common prefixes, common metric conversions, common medical abbreviations. And here's some of those: micro, milli, centis, 10, and their abbreviations, prefix symbols, and their values. So metric conversions used in drug calculations. So 1 kilogram, 1 kg, 1 gram, 1 J. Correction, 1 G. 1,000 milligrams or milligram is mg. Micrograms, so pounds and grams. So there's temperature, volume, and length. So basically, with this chapter, please become familiar with medical terminology, become familiar with directional terminology. It will help you um, in your discussions, both verbally and with patient care. However, I always, like I've said before in earlier chapters, if you do not understand or do not know a word and its meaning, or you do not know a prefix or a symbol and its meaning, please do not use it in your paperwork. Okay, if you're talking with somebody and you're having a verbal conversation, and you do not understand, you need to stop them and ask them the meaning to make sure that not only you understand what they're talking about, but also they understand where you're coming from. With a lot of different hospital systems, yes, Joint Commissions has symbols and that are required and that are standard amongst all of them. However, one hospital system may not use one versus another. Okay, so a lot of these are common that you see here. However, you need to make sure that not only the receiving facility understands you verbally, but also your paperwork. Okay, because you don't want to be called later and be having to answer questions that they don't understand. So if you ever get the chance, take a medical terminology class. They do offer those at the local community college. Um, they're pretty interesting, pretty easy, and they go a whole lot more in depth. I think a lot of those are offered online now, so it wouldn't be a bad class to take. So this is a pretty short chapter, and this is chapter 5.